Good afternoon, class. Our names are Noah Katz, Hannah Hagelin, Riley Russo, Nina Weldon, and our presentation is on gender inequality in South Africa. Gender inequality has existed in South Africa since the 1950s and is still a persistent issue we are facing today. Women across the nation continue to endure various forms of violence, discrimination, wage disparities, forced marriages, and systemic barriers. Regardless of the changes that have been made and progress from gender inequality, it is still a major issue occurring in our world. The inequality that they face has become such a social norm for men and women in South Africa, and not enough people are doing anything to make a change. The issue of gender inequality in South Africa is one that occurs because it is so deeply rooted in societal norms and traditions of the culture. Women are put at a disadvantage right from the start of their lives in South Africa, being subjected to many gruesome body modifications at birth and young girlhood. Beyond these gruesome and unnecessary practices, women are also largely without control of their own decisions. UNICEF reports that nearly 32% of South Africa's women are married before the age of 18. When looking at the culture and traditions of South Africa, it is clear why gender inequality is so prevalent. The idea that women must be oppressed is so deeply ingrained in the culture that it is not only the norm for them to be discriminated against, but it is still dangerous even for them to live their lives normally. As for the current and immediate consequences of the issue, in rural areas, many women have to travel far for healthcare services, and if they do not own their own transportation, it can make it extremely hard to get the needed attention. There are also many expenses that need to be paid for medical visits, and if women spend most of their time in the household doing chores instead of working, they're at a greater disadvantage in being able to pay for and receive these health resources. Even if women decided to seek health care for themselves, there are limited healthcare workers provided due to a gender inequality faced here. Women have to wait longer for medical attention than working men do in South Africa. Raising awareness about gender inequality in South Africa will overall help the health of women and grow South Africa's economy and infrastructure. There are things being done to address this issue, though. For example, UNICEF is an organization that strives to help resolve the gender inequality, helping for things like girls completing secondary school, providing care to young mothers, and preventing child marriages are all important steps in reaching a change in equality. Another company who is taking steps to help this inequality is the Africa Exchange Program. Their main focus is education. They build schools for kindergarten, primary, and secondary students, along with having scholarships for women.